The Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by his statement that this government has put an average of $500 million extra into the health budget each year, and we're providing more services for New Zealanders faster and with better access, providing the services they need?
Honourable Tony Ryle.
Mr Speaker, yes, this year's budget appropriations show that the operational spending has risen from $11.6 billion in Labour's last budget to $14.1 billion this year. That's an increase of $2.5 billion over this government's 5 budgets, an average increase of $500 million a year. DHBs are increasing services for patients. Like the rest of the world, the country's finances are still tight, and district health boards are constantly changing the mix of services and how they provide them within their increasing budgets as they look to make the best use of their available funding.
Supplementary question. Thank you, Mr Speaker. If there is sufficient funding and if there are more services providing faster and better access to services that people need, why, after 5 years, have headlines like these appeared in the media in the last 2 weeks alone? Southern DHB kept lid on crisis, risk of deaths. Health Board apologises for poor care. And this one from the press, patients in agony dumped off lists.
Honourable Tony Ryle.
Mr Speaker, what I've learnt from that member and from others is don't believe every headline that you read in the newspaper, because particularly with respect to that last headline, the Canterbury District Health Board has confirmed that no patients have been dumped off their lists, and this stands in strong contrast to the previous government, which cut 1,000 orthopaedic patients from the Canterbury DHB waiting list in 2006. We expect patients to be treated.
Supplementary question, Mr Speaker.
Honourable Annette King.
When he made his claim in Parliament on the 5th of September that as of June 2013, only 20 patients were waiting longer than 6 months, 9 for assessment and 11 for operations, did he receive that information from the Ministry of Health or from the DHBs themselves?
Honourable Tony Ryle.
Mr Speaker, I'm not in a position to be able to give an exact answer on that. I would say that that information would have come from the Ministry of Health. It's quite a significant achievement that we have many fewer people waiting less than 6 months. It's a really big achievement by our district health boards.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. In light of that answer, then, who does know the real number of New Zealanders waiting longer than 6 months for surgery? DHBs like Waikato, who said that as of June 2013, they had 376 patients waiting longer than 6 months. Or Mid-Central DHB, who said they had 161 patients waiting longer than 6 months. Or the eight DHBs who said that no such data is captured or collected, so therefore cannot be provided to him or to me.
Honourable Tony Ryle.
Mr Speaker, I'd have to say that that member has put in hundreds of OIAs, and what I've learnt is I can't rely on any answer that or any questions that she represents, because my experience was that actually that member circulated OIA responses where she had changed the numbers. And actually I can't trust what she says.
Supplementary question, Mr Speaker.
Order. Supplementary question, the Honourable
more than 20,
Annette King.
Supplementary question. Has he read a copy of the standard letter given to patients by DHB which reads, although it is clear that you'd benefit from surgery and your surgeon and GP would prefer it happens now, public hospitals in New Zealand can only accept patients onto their surgical waiting lists if they can provide the surgery within the next 5 months. And so how many New Zealanders have received these letters and have been sent home, and according to a top orthopaedic surgeon, are living in agony and remortgaging their homes to pay for the surgery privately?
Honourable Tony Ryle, either of those two questions.
I'm really thankful that that member has raised the issue of how many people are getting to see hospital specialists and how many people are getting operations. I can tell that member under this government compared to her position, 40,000 more people are getting to see hospital specialists, 40,000, and 40,000 more people are getting operations. When she was Minister of Health, fewer people got operations on a population basis. We're getting more.
Point of order, Mr Speaker. Point of order, Mr Speaker.
Point of order.
I have a number of documents I'd like to table, Mr Speaker. The first one is from the Ministry of Health, claiming that only 20 people are waiting longer than 6 months. Thank you, Mr Speaker.
I think we'll try and put them all together. So
yes, I then have an OIA from the Mid-Central Health saying they have 161 people waiting longer than 6 months, not 20. I have a letter from the Waikato District Health Board saying they have 376 patients waiting longer than 6 months, not 20.
And just describe the document.
I am, Mr Speaker. And I have a letter from Auckland DHB saying they do not capture such data, so therefore they don't collect it. And therefore, Mr Speaker, the Minister has been misleading us all.
Order. And that last part is not in order at all. Right, leave us sought to table 4 documents, a Ministry of Health letter, an OIA from the Mid-Central District Health Board, a letter from the Waikato, a letter from the Auckland District Health Boards. Is there any...
Point of order, Mr Speaker. I take offence at that comment and I ask the Minister to stand and apologise for it.
Order. I didn't hear the offence. If the Minister made an offensive comment,
I simply asked if they were doctored, like the one with the South
Point of order, Mr Speaker. If we're going to play that game, I can play it as well.
Order. It's members' time after question time that their own members are eating into. If the member had not used the word doctors and used the word altered, it certainly would have been more satisfactory. Listen, if the member's taken offence, I'm surprised by that. Would the Minister please stand, withdraw and apologise?
Now, point of order, Mr Speaker.
Order.
I'm sorry, Mr Speaker.
Order. Would the member please resume her seat? She has sought leave. I want to put the leave and then I'll consider... Well, no, we'll put the 4 that I've described. Leave is sought. There is objection.
Okay.
Now,
point of order, Mr Speaker. I have a letter from a District Health Board telling patients that they can't have their surgery.
All we need to know is which District Health Board
it's the Canterbury District Health Board. And perhaps the Minister might like to see it.
Leave us sought to table now a letter from the Canterbury District Health Board. There is objection. Question number 6. Order. Dr. Cam Calder.